Hi, this is Erin Polta, and today I'm going to be sharing a little bit of information related to autism spectrum disorders. So we'll go ahead and get started. All right. So what we'll be talking about today is the characteristics of autism spectrum disorders, and then I will move into a little bit about how we diagnose and actually treat those disorders. The third part, probably the most important part, is the impact on daily life, and this is going to be specific to a child's visit at the barber shop. I conducted recently an interview with a local hairdresser and kind of educated myself as far as some of the questions that they had regarding autism, and then put together some strategies to help. And that ties right into the last part, proactive strategies. And they can really be applied to a lot of different situations, but again, these will be specific to the barbershop visit. So first of all, what is autism? It's a disability that impacts people in a combination of two areas. And this is based off of the most recent criteria, which is known as the DSM-5. That stands for the Diagnostic and Statistical Manual of Mental Disorders. And this is basically what we use to help diagnose autism spectrum disorders. So in the two areas, first we have social communication and social interaction. And then the second area is restricted repetitive behaviors, interests, or activities. And one thing to note is that autism is a spectrum disorder, and what that means is that individuals can experience a range of severity. Therefore, the disability might look a lot different from one individual to the next, depending on how severe it is. So getting specific with those two pieces of criteria, the first one is social and communication interactions. So you might be wondering, what does an impact on communication look like? And students with ASD must have deficits in all of the three following areas. So the first area is failure to develop age-appropriate relationships. I see this a lot in my kiddos, where oftentimes they'll actually gravitate more so towards adults rather than kids their own age. They really struggle to make friends with same-age peers. The second piece of criteria is a lack of nonverbal communicative behaviors, and these can be things like eye contact, using appropriate hand gestures as they're talking, using facial expressions to convey different emotions like feeling excited or feeling sad or angry. For a kiddo with autism, all of those facial expressions may very well look the same. And then the last aspect is a lack of social or emotional reciprocity, which basically means that they have a hard time showing their affection towards somebody else. Whereas if we were to smile at one another, greet one another, they have a lot harder time doing that. The second area is the restricted repetitive behaviors. And I listed out specific examples, again, that are pulled from the DSM-5 criteria. And again, to qualify in ASD, individuals must exhibit at least two of these characteristics. So the first characteristic is interests that are abnormal in either intensity or focus. One kiddo that comes to mind is an adult that I ski with who has autism. And I know he has some very, very specific interests. Oftentimes, what we talk about is the Harmar Shopping Center. It's a shopping mall near his house. Or we'll talk about hair, like haircuts and hairstyles, whether or not we braid our hair, how we like to wear it. And really, those are kind of the two main things that he likes to talk about. So clearly he's got a very intense interest and focus with the shopping mall and with hairstyles. A second characteristic is inflexibility. People with autism may have a need to stick to very specific routines or rituals, meaning that if they do something a certain way, they need to stick to it. It's hard to differentiate or break from those routines. A third characteristic is repetitive speech and motor movements, and some examples of those might be hand flapping or finger twisting, And again, they might say the same things over and over again. I have some kiddos at school that will say the same greeting over and over again, and they say it the exact same way, no matter who they're speaking with. And sometimes they'll say, "Hi there, how you doing?" Several times, even though they've asked it maybe 5 or 6 times already. So it's very, very much repetitive in the same phrases. And another thing I don't have on this slide that kind of fits with that is the echolalia. That is essentially repeating or echoing what they hear other people say. And sometimes you'll see individuals who have autism doing that as well. The last characteristic on this slide is under or overreaction to sensory input. And this could be something like pain, discomfort, reactions to temperature. I know one of my kiddos has certain shirts that he needs to wear, and depending on what the tags are like, he may or may not be able to wear those t-shirts. So things that we might not think much of as far as the way that it feels or the way that it tastes or sounds may be very, very intolerable for somebody who has autism. And again, it may be an underreaction too, where something that might normally hurt for us, like if we burnt our finger or our shoes were too tight or we felt too cold, they might not notice that. They might not have the appropriate reaction to that stimuli. So it could be one or the other, overreactive or under. All right. The last thing that ties in with criteria is the fact that the symptoms must be present within early childhood years. However, they might not always become clearly evident until the child is older, and then the social demands continue to grow, and eventually they become further and further separated from their peers, and those differences or discrepancies become more obvious. The symptoms must also limit or impair their everyday functioning in some way. Another thing to note, aside from behavioral and social impacts, autism may have an impact on their diet. And this is something that was new to me that I thought was interesting that I would just include. But individuals with autism may have difficulty fully digesting and processing some of the proteins that are in a lot of dairy and wheat products. So you may see a lot of individuals sticking to what we know as a gluten-free and casein-free diet. And essentially what happens is if they eat these things, the proteins aren't fully digested and essentially kind of have a drug-like impact on the body. They wreak havoc, and then that can lead to problematic behaviors in those individuals. So to avoid that, sometimes dietary restrictions may be put in place in order to help. All right, so the next thing to talk about is moving into more of the diagnostic area. And I think one of the most important things that we can do for individuals with autism is early intervention, which essentially means catching it sooner than later. And I found some kind of red flags, a little checklist from autismspeaks.org that parents can be looking for within the early years to help with that identification. Some of these examples might be no big smiles or other warm, joyful expressions, which you would generally look for around 6 months of age or later. They might not have the back and forth sharing of sounds or smiles or other facial expressions by 9 months. No babbling by 12 months, so their speech might be impaired. There may be no back and forth gestures like pointing, showing, or reaching or waving by 12 months. Another thing to look for would be no words by 16 months. No meaningful two-word phrases, and that includes not imitating or repeating by 24 months. And any loss of speech or babbling and social skills, so looking for kind of a backward slide or a regression might be another red flag for parents to look for. How do we screen for autism? Some of the first steps that can be taken are with the parents, and one tool that's available is called the MCHAT, which stands for Modified Checklist for Autism in Toddlers. This checklist is really convenient. It only takes a few minutes to complete. It can be completed online, and based on the results, they will indicate whether or not your child should be screened by a pediatrician. And I've included the link right here. You can find it right on autismspeaks.org. Some other screening tools that might be used in looking at autism are the ASQ. This stands for Ages and Stages Questionnaire. A second one is the PEDS, which stands for Parents' Evaluation of Developmental Stages. And kind of a subset of that one is the PEDS-DM, which is the Parents' Evaluation of Developmental Stages, looking at developmental milestones. And one thing that you will notice with the screening for autism is that a lot of it will be done through checklists and observations. Right now, there's really no identified genetic cause of autism, although medical experts are looking for that, seeking kind of like trends and patterns. But as of right now, the tools that we rely on are a lot of checklists and input from parents and teachers and doctors. So that's kind of what that looks like currently. There's not necessarily like a blood test that a child could take to indicate yes or no that they have autism. More resources for parents include different medical professionals, and I kind of pulled together a list that I found from class. The first one would be your developmental pediatrician, which is the person that most people see for their regular doctors and visits. So they would help examine a child's development overall. And then they would have a certification in developmental behavior, so a little more expertise within that area. The second resource is a pediatric neurologist, and they have special expertise in diagnosing and treating disorders of the nervous system. The next resource would be a child psychologist, and they focus on the mental, social, and behavioral development of the children. And a lot of times schools will have professionals like this, a school psychologist, that will look at a lot of those things when looking at an educational label for autism. The next resource is a child psychiatrist, and they specialize in prescribing medications to treat various mental health issues. And then the last one is more of not so much screening, but then support once that diagnosis has been given. So there are different therapists that can help treat autism, like speech therapists, occupational therapists, and physical therapists. And so speech therapists would serve to really address those communication issues that kiddos might have. Occupational therapy has to do more with motor ability and different sensory supports. I know there's a lot that we kind of mentioned, aversions to touch and smell and certain things, and occupational therapists are great resources for coming up with ideas to kind of help kiddos with their sensory processing. And then physical therapists, again, help with like the motor development and coordination that kiddos might need. So those are a few different areas and resources for parents to access. The next one is just a little note that it is so important to be proactive about this, especially with the screening and diagnosing. One thing that I found that was so surprising is that only 8% of primary care physicians are screening for autism, and then of those, only 25 to 45% use a valid screening measure. So I think as a parent, it's so important to advocate for your child's needs and make sure that if you have those concerns, seek out those resources and supports that can help you, because it seems that not a lot of doctors are actually doing this. All right, so now moving into looking at the scenario at the barber shop. As I said, I conducted an interview with a local barber, and I compiled a list of ways that an individual with autism might be impacted when visiting the barber. And I kind of divided it into social and behavioral impacts. And looking at the two, I think behavioral might be the largest area that's impacted, but regardless, social is very important to consider too. So starting with social impacts, a child might not have the social skills necessary to carry on the casual conversation. I know a lot of times when I go to the barber, we kind of chime back and forth and talk about how we're doing and things that are happening in daily lives, and that might be hard for a kiddo who has autism. So it's just something to keep in mind. Another impact might be that they may not have the communication abilities to actually express concerns like pain or discomfort, if they're feeling nervous or have questions, or perhaps preferences and how they want their hair to look if they have a certain style. Another impact is that the client might be enjoying themselves and feel content, but they don't have the ability to show that through their body language or facial expressions. They might come across as having a very flat personality, which is not the case for everybody, but that's just something to keep in mind. The client might be completely nonverbal and might need to rely on other forms of communication like picture cards or soundboards. And the very last impact within the social area is that they may not reciprocate various emotions, such as if you smile when they arrive and you greet them, that might not happen. Now, looking at behavioral issues, one of the most important things that I thought would be important to plan for or foresee was the overreaction or underreaction, for that matter, to the sensory input. And so some examples is that they might not like the feel of the clippers buzzing against their skin, or perhaps the water temperature as you're washing their hair. They might not like the cape tied around their neck to keep the hair off of them. The sounds might be scary, the sound of the clipper, the sound of the scissors. And then other things too that I don't have on here, possibly thinking in mind with all the senses, they might not like the smells of certain shampoos. And that would be something that hopefully parents could give you an idea of. If there's a certain scent shampoo that they prefer, that they would be a good resource to ask about that. Kids might exhibit poor posture that might be accommodated in order to sit in the chair properly. You wouldn't want to start right away with using belts or tying kids in place, because in the end that might make the experience more traumatic. So it's important not to resort to that right away. But if it is necessary, if they don't have that motor ability to keep themselves upright as a safety precaution, it might be something to be considered. Other issues might be their repetitive body movements. If they flap their hands a lot or move their arms in a certain way, it might make it a little bit more difficult to cut hair safely. So something to keep in mind, maybe planning for more time, knowing that you would have to accommodate those things. Other behaviors are that the patient or client may wish to talk about very specific topics or interests to them. And it might be helpful to find out what those interests are so that you can pull them in and get them engaged in conversation if they have certain things that they really enjoy talking about. The last thing that I thought of regarding behavior is that once a routine has been established for the kiddo, they might struggle with slight variations in that routine. For example, if they came to the barber once, maybe they prefer to sit at the same chair every time or work with the same barber. So those are some things to think about that could impact a kiddo with ASD if they're at the barber. And granted, this is not a comprehensive list, but these are some of the biggest things that came to my mind when talking with the barber and doing my own research. So then moving on for ways that we can support them, support strategies. And I kind of broke this into 3 parts. So we have ideas for prior to the visit, during the visit, and then after. So I'll back up. I think prior to the visit might be one of the most important things, is just the planning and getting ready. And so I started with a suggestion to contact the hairdresser prior to the visit to ensure that they're willing to work with a client who has autism. Second, you would want to familiarize your child with the haircut process. And this could be done in a variety of ways. You could use social stories that you've created. You could find videos online. Or you could take them to the barber shop too, so that they could see and get an idea of what it would be like before we get there. And I think I've got that further down my list here, so I'll get to that. Another thing to consider would be buying some of the tools that are used at the barber shop, like the buzzer, the scissors, and other things, and let the child see them and touch them and play with them just to become familiarized. That way it's not scary and shocking the first time they go there. It's something that they've seen and they're used to. Yep, and then here's the idea I had referenced before. Bring the child to the barber for a meet and greet ahead of time, so that they could meet the person they'll be working with. They could do things like try sitting in the chair and exploring the environment just to become familiarized with it before they get there. Another thing to consider is the child's aversions to certain scents of shampoos, or if they have preferences for the temperature of the water. Maybe they don't like things that are very cold, or maybe they don't like things that are warm. And so it's something to consider. And then it's also important to communicate the foreseen issues to the barber and share some basic tips for working with a child. And some examples, like I said, are known aversions, maybe sharing topics of interest that the child has, or the types of communication methods that work well for the child. If they're a kiddo who's nonverbal and needs pictures to communicate, that would be very important to know before they were in the chair with you. So then during the visit, it would be a good idea to probably start with a friendly greeting with the hairdresser and just take some time to get comfortable with that person, making sure that you're getting down on one knee and getting to the child's level and just trying to make them feel comfortable before you get started. The next thing would be to allow the child to make some choices about their visit. I think if they have choices, they feel more in control and it's a little more exciting for them. And some simple things could be like, where would they like to sit? If there's open chairs, maybe allow them the choice. Or if there's different color hair capes, they could choose a color cape that they want to wear. Or different types of shampoos. So there's lots of things, ideas that you could work in with that, but trying to build in some choices. Another idea would be to use a visual picture schedule that would show the child, what would happen throughout the visit. So that schedule might look something like, first we sit in the waiting area, and then the barber calls our name, and then the next thing would be washing the hair, and then the next thing would be clipping the hair, and maybe have one for scissors and one for the buzzer, if that would be used. And then the very last thing would be drying the hair, getting it blow drying or styled. And you could go through piece by piece and really break down what was going to happen so that the child understood what was going on throughout the whole visit. I think it's also important to use lots of praise for good behavior and the verbal reassurance throughout the visit. Other things to consider could be bringing along favorite toys or a type of video that would help distract the child during their visit, get their minds thinking about something else other than what's happening. And other tools that might be helpful could be things like weighted blankets for kiddos that have sensory needs. Maybe some earplugs to reduce noise. If the sound of the clippers is scary, they could possibly put in that, or maybe an iPod to listen to some music instead. Or if there's too much going on, if it's too bright or there's too much visual stimulation, they might benefit from having some dark sunglasses or something to wear. So those are all ideas, and a couple pictures up here. This is a picture of what a weighted blanket looks like that you could possibly wrap the child in. And then using something like an iPad to play their favorite movie also could be helpful and fun for the kid. Last is support strategies for after the visit. And again, once the visit is done, it's so important to praise them and then offer rewards also for good behavior. For example, tell the child that first you get a haircut and then you get to pick out your reward, whether it be picking out a sticker or playing at the park or going to have ice cream with mom and dad. So kind of using that first then strategy. First we do this and then you get to do something fun. It's also important to follow up between parents and the hairdresser to discuss what went well, and then plan some strategies for future visits. And then additionally, share those ideas with coworkers. The more knowledge and effective tools people have, the easier we can address the needs of people who have autism in the future. So I think it's good to share what you know and be open to further communication along the way. And from personal experience, parents are such a good resource. I think they have a lot of helpful ideas. So don't be shy about asking, and really try to dig for as much information as you can, because I feel like the more you know, the better off you'll be. This right here is a video that I found that goes through more tips for basically a successful haircut experience for a kiddo. The link is right here on YouTube. And then I thought, in addition to using this video, it might be worthwhile to create your own video that documents the different steps involved in getting a haircut. And so again, this kind of ties into the idea of creating social stories, which I mentioned earlier. And then what you would do is play this video for the child prior to their visit, and that will help familiarize them with the process of a haircut, and then they'll kind of know what they can expect during that haircut. So I won't play this video right now, but I think it's worthwhile to check it out. They have a lot of good tips, a lot of things that we've already mentioned, but then some new ideas as well. And then the last thing, just to sum up what we've talked about, we have reviewed some of the common symptoms of individuals with autism, and again, in understanding that a lot of those symptoms are behaviorally related, and then the other half of that is the social communication side. So there's two main areas of impact. And I think some of the important takeaways from today are the fact that autism is not widely screened for or treated. I think there's still a long way to go as far as awareness and proactive strategies for people to use. Secondly, the disorder can have, as I said, major social and behavioral implications, but there are many proactive strategies that can be done to help support these individuals. So again, just please continue advocating and sharing these ideas and resources with others. And last but not least, these are some of the resources that I used. I think one of my favorite resources out of this list was actually autismspeaks.org. They have a lot of different interesting articles to read, and then links to additional resources through that website as well. So I would encourage you to check it out. Definitely worthwhile. And then just some other resources as well. So thank you for listening. I hope you enjoyed, and I hope you learned some new things and got some new ideas about autism. Again, thanks for listening. Bye.